First of all, what is politics? What are political forces and actors? There are many issues that people talk about, like the government, the parties, also the municipalities. There are some policymakers, some of them are bureaucrats in there, and some bureaucratic institutions have their traditions. So the parliament is part of the ruling branch. They make laws, lawmakers, the legislative branch. Also, political ideology is predominant in a country or a region, can be part of the political forces that will affect not only healthcare but a lot of social inequalities. Labor movements are part of politics. Some of them are institutionalized in trade unions. Some of them are some of the forces are also non-governmental organizations that can affect healthcare access or more in terms of inequalities. Feminist movements, especially when it comes to abortion, or as one of your friends wrote in the comments, an abortion or uh, birth rights. Um, Feminists have a very important role in defining politics, and LGBTQI movements, which has a huge power on actually changing the perceptions on homosexuality, especially as a medical issue. For a long time in many countries, the homosexuality was an illness and a mental illness, and then there was there were a lot of movements all around the world that changed this issue. Also, a lot of other social movements can have an impact on political forces that will affect inequalities. Also, if there's a conflict in the region in terms of territorial authority, like Israel, Palestine, like Cyprus, like Sudan, like Syria or Iraq, and then it will affect, of course, all the political issues in the country. Um, if there's anything else that comes to your mind as political forces, please add to your comment. Um, Another issue is from those articles is political economic regimes as part of social determinants of health. There are a lot of different types of regimes like advanced capitalism, socialism, communism, social democracy, fascism, liberalism, conservatism, and many other political economic regimes in different countries and different histories and different places. And part of those regimes become social determinants of health, as we were referring to the first lecture. You can go to the first video lecture now to see what were the social determinants of health we described and we discussed. So how does the political economic regime in a given context can affect social determinants of health and become part of social determinants of health? Like, for example, in advanced capitalist countries, the mode of production is capitalism, so it's a pro-capital and pro-market, and this will give a lot of responsibility to the market as a healthcare provider and privatization of healthcare. In socialist regimes, like in the Soviets until 1989, 91, and in a lot of other socialist countries that are post-socialist right now, they have other types of values that they attach to healthcare and education. Very strong state presence and responsibility for healthcare. Also very pro-labor as the political atmosphere. So working conditions were very important and healthy, depending on the strong state regulation and the socialist values that gives a lot of importance to equal opportunity, equality, and equal access to healthcare. Communism is another one, which is tied with communal values and strong state, although socialism practically, I mean, practically it didn't happen, but theoretically communism was the next after socialism, next stage of after socialism. And this stage has no state, but in communist regimes like China, they had a very strong state and state party. So these will be very much like socialism in terms of healthcare. And social democracy has other values, social and democratic values, as it is in the name, and welfare state tradition, which will take care of the citizens despite any differences. Fascist authorities, like in Italy, in Hitler Germany, in many other places that we don't hear that often, but has a lot of fascistic methods by strong authoritarian state and the lack of democracy. So this changes the impact of social movements on the states. If fascist countries do not let their citizens to intervene any social change into the government, then this means not much change. They can be very status quo, and of course they give a lot of importance to armed forces in terms of police and military. So they prioritize these authoritarian states means, violent means, or other issues like healthcare and education. Also, another regime is liberalism. So this will like advanced capitalism has liberalism in it in terms of political ideology in a way that the ideologist has that the markets should be prioritized over states in responsibility of healthcare, which will lead into very pro-capital, not so much pro-labor activities. Another regime that we can talk about is conservatism. Conservatism is can be existing with other regimes, of course. It prioritizes status quo and tradition and habits. It will affect healthcare inequalities in a way that it will give a lower status to women. It will prioritize family unit, and the male as a breadwinner, and how woman as a housewife. So it will change the healthcare inequalities on women in a negative way. There are a lot of other combinations and a lot of values intertwined with these different regimes. Some of these regimes can actually exist together, can coexist, and some of these issues can survive within different populations in the same country. So think about all the combinations and value differences and value similarities among these regimes, political economic regimes, that will define how economic activities are sustained and established. Also, how government territorial authority activities can take place in different ways. One of the things we keep talking in as an underlying force, and I mentioned this in the first video lecture as well, is a democratic participation as part of social determinants of health. How can it affect the health? What is the link between democratic participation and healthcare and access to healthcare? There are a lot of examples that one of the articles give. Kerala is one of them in India, and Northern Italy is one of them. Very recently, Greece is one of them, and Scandinavian democracy welfare traditions have this participation tradition as well. If you go to details of these examples, what we can say is the governments decentralize their authorities. This means basically more power to the people in the local, but without cutting the bridges with the central authorities. So, like what happens in Kerala, India has a lot of states, big states. It's one of the biggest countries with highest populations in the world. So Kerala is only one region which is run by the Communist Party, and they prioritize healthcare, but also local participation of of defining, identifying healthcare issues, and defining and identifying social inequalities that may have an impact, that actually will have an impact on healthcare status of people. Same in northern Italy. It is also a small part of Italy which will run by ex-communists, which have more left democratic principles right now. Greece is very recently elected Syriza as a government. Syriza is also known as democratic left, multicultural left. These countries prioritize these countries and these regions prioritize democratic participation in deciding for healthcare and for social inequalities that will have an impact on healthcare. By having this organized power and social movements that can have an impact on healthcare status, you actually give people some power and empowerment to change whatever is wrong in their actual experience. Of course, some of these issues are expertise, like physicians may know better what to do in certain cases, but also if we listen to people's experiences of inequalities and their understanding of healthcare in their subjective experience, you can also make up patterns if as a sociologist to understand what is wrong in those communities, what can be done in terms of better healthcare facilities. So it's more like it's not only surveying or polling with people. It's not only taking their actually opinions about what to do in healthcare. It's not a referendum. What I meant is more like actual decision-making processes by the people about budgeting their municipalities, about reducing income inequalities, about making their health important and prioritized. And how do political differences play a role in healthcare? If we link these ideologies that we talked about, political economic regimes and the political differences, what is the direct link to healthcare? One of the most important things is social security expenditures. If the country expands their income or wealth into social security or not. If the country has an important policy of public employment or not, because working conditions are very important. By important, we mean like if there is no job insecurity, then you feel much less stressful. And many countries actually had a policy of full employment by the state for some time. So this will have an impact on health as well. Organized labor is also part of this logic. The working conditions, the empowerment among the workers, having much less stressful lives and much less physically difficult lives with better working conditions due to organized labor and trade unions is part of this deal as well, to increase healthcare status of people. Also, healthcare coverage for all as a political value. This is for not discriminating anyone. In some countries, the healthcare coverage is only for the working people. So for many other countries, especially Scandinavian democracies, they still have healthcare coverage for all as a political value. High-level taxation for public services. If the state tax you a lot and put this into public services, then there are better health public services for all in certain cases, unless there is not much corruption, of course. And it also says universalistic social policies are important for healthcare. By social policies, we mean employment, housing, environment rights, neighborhood rights, all social security issues, such as insurance, better insurance, as one of your friends wrote in the comments, public insurance especially, that you can trust and rely on, and other kind of social policies that will affect all your healthcare issues and health status as a well-being of yourself and your mental sanity. Also, integration of women in labor force with equal pay is an important dimension of these political differences in these contexts affecting healthcare. Why is it important? Because if the labor force with equal pay for women um, becomes integrated, then actually women's healthcare status becomes more uh, increasing in a way that in a positive way. So that they can, first of all, they can participate in working conditions and organized labor movements. But second of all, they will have a better income for themselves, so female women will not be out of the the social change, but also the affordability of healthcare. Um, Another issue is actually another value or a culture, as you can say, a culture of solidarity and of equal opportunity. So people will take care of each other, and they will be within solidarity to each other when it comes to change in healthcare issues and changing the status quo. Um, and there can be many other political values differences that can play a role in healthcare, but these are the most striking ones in the article and in general. So the article goes through the primary reasons for income inequalities. One of them is the percentage of national income that goes to capital versus labor. The second one is the wage dispersion with labor. The third one is the distributive effect of state interventions, i.e. changes in disposable income of households and individuals as a result of adding transfers from the state and subtracting income paid and taxes and fees to the state. So if we go down one by one, capital versus labor, which means like there's national income, wealth coming through one nation state in one way or another, and where it goes, where the state, where the government spends this money is very important. It says if it goes to capital versus labor, which means if as the governor of a state, if you accept the the companies and subsidize companies to promote and produce more capital, but do not do anything about labor rights and movements. This is part of it, part of the percentage that goes to the capital. And for the labor and farmers, actually, you can add into this that we can also talk about um, the farmers getting more subsidies from the state, the workers getting the insurance from the state. So national income goes to that side. This doesn't have to be capital versus labor, but in most of the case it does. The state chooses one over the other and works accordingly. And this will have an impact on income inequalities, of course. The gap will be in capital and labor, as most of your rights, as is, the 1%, the richest become richer, and the poor become poorer, kind of logic. The second one is the wage dispersion within labor. So if it is if the country's labor, like the work and the salaries you receive from the work, the wage, is so much different from each other. If managers have like 30 times more than the workers, then there's a problem there in terms of income inequalities. This is very obvious and direct, actually. And the last one is the redistributive effects of state interventions. Um, Redistributive effect means like state getting the taxes and paying it back as public services to people. So if it subsidizes the companies over workers, then the redistributive effects will not work. Redistributive effects, which means like taking the resources and distribute it in a way that, in an equitable way, to everyone as a citizen. You get from the tax from the rich mostly, and it's not equal tax for everyone. It's depending on your income and on your status. So redistributed it's as a state organization. So I want you to ask now to take notes about what are other primary reasons for income inequalities you can think of. And the article says these data seem to allow the conclusion, therefore, that to reduce income inequalities and infant mortality, it is advisable to support labor-based social democratic parties. On page 486, I also want you to think about if you agree with the statement, and if you look at actually the social democratic elements and how it becomes part of the political regime in the political context article, then you can see a lot of political differences that we talked about in social democratic parties compared to conservative and liberal and fascist governments. So you can see how the political parties in rule can have an impact on these issues. So before getting into conclusions, I actually would like to go to these articles to see the wage inequality, equality. The first one is this one, I think. So if you look at the political characteristics, policy outcomes, and the welfare state in the late 1970s in Europe and the different countries, actually United States is in it too, as a comparison, I guess. Also Canada is part of it. So what we see is the social democratic tradition countries, which are Austria, Sweden, Denmark, Norway, Finland. These are basically these are the Scandinavian democracies except Austria. But you can see how the public expenditure on health is increasing, and it is very important. And in the table 3, you can see the total public medical care percentage. And compared to Christian Democrats, liberals, and ex-fascists, they are a bit better off in terms of public expenditure. Also, economic growth and unemployment is an important issues in those traditions. And total profits and gross fixed capital formation data, they have it to understand what's going on. If we come back to our conclusions from these data, we can see that political variables such as the political party in government, either alone or as a majority partner in a coalition for longer periods of time, are important in influencing a country's level of income and social inequalities and its health indicators such as infant mortality. These political forces represent the interests of classes, either capital or labor, or in between classes. The class can be very diverse, and other social forces with different interests in redistributive policies. Also, all these actors we were referring to, like trade unions, feminists, LGBTQ activists, and other interests in redistributive policies. The labor movements and the social democratic parties that have governed as a majority for a long period since World War II have generally been the most committed to redistributive policies, contributing to better health indicators such as lower infant mortality rates. There are some social and political commitments here. Another conclusion is the countries with weaker labor movements and social democratic parties and stronger capitalist classes, such as the liberal Anglo-Saxon countries, which are United States, Canada, Great Britain, um, let's just say Britain, have had a weaker commitment to redistributive policies and worse health indicators. So you can see the per capita countries may not be making as good as the other ones in terms of health indicators. Another conclusion is the Christian democratic parties or conservative parties rooted in the Christian tradition have made a compromise with redistributive policies that are weaker than in the social democracies but stronger than in the liberal countries. These liberal countries are the Anglo-Saxon countries, which are very pro-market. Also, do not forget that this is a Eurocentric story and Eurocentric, Western-centric, and cannot be generalized. These are not universal conclusions, they are context-dependent, and these are the conclusions for this unit of this study. So, these are important issues, and the different traditions in this article, it is social democracy, Christian Democrats, liberals, and fascists. By fascist, they mean a fascist part of history in Spain, Greece, and Portugal, Southeast Europe, and they look into all these variables to figure out what is the impact of politics. And they found out the social democratic values in terms of politics and policies, actual policies and implementation, can have an impact. I would like, so there's another paradox that we read in a small article. The country spends enormous sums on healthcare. American people receive less healthcare, and Americans are less healthy than their counterparts in other developed countries. When you look at Sweden or Switzerland, or even England, to be honest, you can see how much amount of money that the country spends and the amount of healthiness, like infant mortality, life expectancy, and even more issues of health care factuals are not working very, very well as an outcome in America, in the United States. So, for example, comparing the United States to 17 other wealthy industrialized nations, including France, Japan, Canada, and Britain, Americans had a shorter life expectancy, higher rates of disease, the highest rate of infant mortality, and the lowest chance overall of surviving to middle age. This book is the study done by Professor Elizabeth Bradley, and she basically says the United States spends a significantly higher percentage of its gross domestic product, as much as 50% more than other developed countries, on health services like acute hospital care, rehabilitative care, diagnostic imaging, laboratory tests, and health insurance. But when that percentage is combined with the much smaller amount spent on education, old age pensions, disability and sickness benefits, family support and employment programs, unemployment benefits, and housing support, the United States ranking drops precipitously to one more in line with its poor healthcare outcomes. So what she says basically is it's not the healthcare expenditure, healthcare services, the money you paid on health services. It's actually the other things, the social determinants of health, that you couldn't spend as much money, like education, like retirement, like pensions, like disability benefits, like family supports, like employment and housing issues. All this background, the social determinants of health, is affecting the health status of people so poorly that the amount of money on health services is not going to trickle into the population. It is also the privatization of healthcare in the United States. It's not very public. It also shows healthcare became a profitable industry with powerful special interest groups battling each other for the spoils. So it is a lot of money that is being paid by the United States government to insurance companies and by United States people who is paid to these companies, insurance companies, and they became very special interest groups that when you see Obamacare and its details, you can obviously see one of the most opponent group with very, very special interest is insurance companies. Although it wasn't about the private insurances, it was about more about the Medicaid and Medicare and then its extensions. To be honest, Obamacare is more about the disadvantaged communities rather than changing the entire healthcare system. But still, um, on the other side, the social services fell into the domain of government agencies and a handful of non-profit organizations, utilized by only those who couldn't afford care otherwise. So by this we mean Medicaid mostly. In a country that continued to cling to the ideal of rugged individualism, reliance on such services came to be seen as evidence of a person's weakness and a sign of financial moral impoverishment. You can see the effect of culture and effect of tradition in the country. The more individualism, very, very like kind of vulgar individualism predominates the country as a culture. You think the welfare services um, are dependency, like you are dependent on them, so it's your weakness. You couldn't achieve the American dream. You couldn't get the uh, financial accomplishments that you should have done. But it is more structural than your individual problem, and there's nothing wrong about a state making you have better healthcare. Anyway, so let's continue. The healthcare system of the United States. First of all, I would like you to think about what are the problems and what are the opportunities in the United States healthcare system from the readings you have done. The readings are very short and very, very informative, and it has a lot of like experiential learning in it, that they talk about people's actual experiences. From the New York Times article, there are articles actually that they have a lot of reference to what's going on in people's lives, and how this care can have an impact on people's lives immediately when you especially think about the Kentucky example. Um, so let's talk about what is it and what the Affordable Care Act can change, or did change, or would like to change. You may be liking Obamacare, like the name is Obamacare now for some reason, because Obama wanted to, actually was elected for that reason, and wanted to implement it. Although a lot of things happened in the Congress, there was a deadlock about the healthcare bill and etc. I don't want to call it healthcare like Obama care or healthcare bill. I think I will call it ACA, the Affordable Care Act. Because it is the actual name of the act, without any political connotation. And you may like Republicans, you may like Democrats, you may be independent. We will just go through what it is objectively and what it means for people. You may have an actual opinion on it, which I would like you to have, and it's a political opinion, of course. But also it is a practical opinion for such and such things. So let's go through the healthcare system briefly and what Affordable Care Act means. I took it from the health official health website, HHS. You can have a look at it. I put a hyperlink on here, Affordable Act. And you can look into details of the act, of course, if you haven't done so still. It was 2012, I guess. In 2010 they wanted to do it, but in 2012 there's a Supreme Court decision. So Affordable Care Act. So it changes the coverage. Simply, it ends pre-existing condition exclusions for children, which means health plans can no longer limit or deny benefits to children under 19 due to a pre-existing condition. It will keep young adults covered. If you're under 26, you may be eligible to be covered under your parents' health plan. These are all dependent on context. And the coverage ends arbitrary. This type of coverage ends arbitrary withdrawals of insurance coverage. As you may very well see from SICO, the insurance companies are have a very big impact on your healthcare, and they are private insurance companies. So they will, of course, prioritize profit maximization over public health, because it's not their duty. It's mostly government's duty to think about the healthcare of the people and the public health. So if you think about what's going on in terms of letting insurance companies do whatever they want to do for you, then there are a lot of arbitrary withdrawals. There's a lot of arbitrary additions to the premiums due to one of the small things like tooth removal or something that, or elder, like getting old, like there are some ageist policies as well. Of course, it has practical implications, which is basically when you are older, you may get sicker. But this may not be the case all the time, of course. Um, and the guarantees your right to appeal. You now have the right to ask that your plan reconsider its denial of payment. So the coverage affected in this way. I'm going very briefly because you already have read very many details of it. What about the cost? How the cost changed? So the Affordable Care Act ends lifetime limits on coverage. Lifetime limits on most benefits are banned for all new health insurance plans. Um, so this is exactly what it means. The lifetime is limited for certain insurances, so they may not cover after 90. Um, and then I don't know the details. Let's just look at it. And it costs the previous healthcare plan. I don't know. I know the changes very well, but anyway. So the costs also, regarding the costs, the Affordable Care Act reviews premium increases. Insurance companies must now publicly justify any unreasonable rate hikes. So if they increase the premiums all of a sudden and send you an email or whatever, like a mail post, they have to justify very well why it is happening. So some of the things you saw in SICO may not happen after Affordable Care Act. Um, and then it helps you get the most from your premium dollars. Must be spent primarily on healthcare, not administrative costs. So it's about the expenditure of your dollars premiums. About the care, so the Affordable Care Act covers preventive care at no cost to you. You may be eligible for recommended preventive health services, no co-payments. By preventive health care, we mean vaccination and some other kind of checkups for not to get sick. Also, it protects your choice of doctors. Choose the primary care doctor you want from your plan's network. This was the case before too, but it became more obvious in the law, I think. And the Care Act removes insurance company barriers to emergency services. So this was one of the most important things. When you have emergency situation, you even have to pay the ambulance so much. It's still the case actually, but you can seek emergency care at least at a hospital outside of your health plan's network for free this time, or with small co-payments, which is a very important change. So let's go to the Supreme Court decision after the Act. The Act is intact on 2010, I think it was mentioned. It was planned in 2014 it would be on, but it changed a lot due to Supreme Court decision. The individual mandate and the Medicaid expansion are the two things that are very important for the Supreme Court decision. These two, Florida took it to the Florida state took the Affordable Care Act into the Supreme Court, so that it was discussed, and 26 other states became part of this law case in the Supreme Court. It was a very historic one. If you want to read the details, please Google it. You will see a lot of details. The report that I sent it to you, Kaiser Foundation, is pretty detailed, so you may want to read it thoroughly if you haven't already done so. By individual mandate, we mean a requirement by law that certain persons purchase or otherwise obtain a good or service. So it basically says that everyone has to have healthcare insurance and coverage. So it can be private or public. And if you want a public one, then you have to prove that you need it. with dollar amounts of income and with other proofs of documentation, etc. Um, this individual mandate is, of course, exempted for undocumented immigrants, religious objectors, and people who are incarcerated. These are other things, other inequalities that we should think about, by the way. Like why is a prisoner, why can't a prisoner have healthcare insurance, um, or how come the undocumented migrants are out of healthcare in many ways, especially in certain countries who let um, undocumented immigrants into their country for economic reasons, for cheap labor, to be honest. And I'm not against immigration at all. I'm an immigrant too, to be honest. And undocumented immigration has a lot of reasons, mostly global structures. That in certain countries there are a lot of horrible things happening. They're escaping from war, or they're escaping from poverty, to be honest, which is coming from all these debt relations, the colonization, colonialism that we will see later more thoroughly. Um, all the historical reasons make those people immigrants and undocumented immigrants. So don't think of it as a individual decision, individual choice kind of issue. Um, Also, prison system in the United States has a lot of structural inequalities, like especially on black populations. There are a lot of unjust arrests happening. So think about all the details when I say these things, because I'm not saying it's a matter of choice in general, but these are exempted from the affordable healthcare and this individual mandate. That's the requirement of coverage. So basically, the minimum essential coverage provision of the Affordable Care Act, known as the individual mandate, requires most people to maintain a minimum level of health insurance coverage for themselves and their tax dependents in each month, beginning in 2014. You can see all the states' positions in this small figure that I took it from your reading, Kaiser Foundation. If you want to look at more detail, you can see which states are in, which states don't want to. The other issue the Supreme Court decision had to take an opinion on is Medicaid expansion. I hope most of you knows what is Medicaid and Medicare. Medicaid is the one for the disadvantaged. The Affordable Care Act increases access to affordable health insurance by expanding eligibility for Medicaid benefits. So these are only people who are really in need of subsidies, and it's up to the state. The state will set the minimum like income for being able to apply to Medicaid, being eligible for Medicaid benefits. So it depends. It's funded jointly by federal and state governments, and in the ACA, it was voluntary. It is voluntary for states. So any state who wants to be part of will be part of ACA. If they don't, they won't. And the federal law prior to the ACA excluded non-disabled, non-pregnant adults without dependent children from Medicaid unless states obtained waivers to cover them. So it is not income-based, it was more about the disability, pregnancy, dependency of children, and etc., dependent children number. So this still doesn't include millions of people in America to not be able to apply even to Medicaid. So this would change with ACA. When you see who is out, you can see the eligibility thresholds in January 2012. You can see the children, the pregnant woman, working parents, jobless parents, and other adults. This is the percentage of eligibility under health reform. And the most affected groups are jobless parents and actually jobless adults, elder adults who doesn't have any children, are affected a lot by this eligibility just because their income is low, and it makes be honest, it makes a lot of sense. Even if you don't have a kid, you have to survive. And you have a family mostly of your parents. Anyway, so so let's come to the decision of the Supreme Court. The individual mandate is a constitutional exercise of Congress power to levy taxes. 13 Article 1, Section 8 of the U.S. Constitution in pertinent part provides that Congress shall have power to lay and collect taxes, duties, imposts, and excises, to pay the debts and provide the common defense and general welfare of the United States. So they basically considered this as a tax issue, not a commerce issue, not an industry issue, which is great because it sounds like there is a public health issue going on in the judges' minds. So this basically thinking individual mandate, like considering individuals responsible, but healthcare for all kind of approach. So either public or private health insurance, making it compulsory almost as a matter of choice, is a matter of taxes, and Congress has enough power to do this in terms of collecting taxes for public health and common good of the United States. So the Supreme Court said individual mandate is a constitutional right. So the reasoning were threefold. First one is, for most Americans, the amount due will be far less than the price of insurance, and by statute, it can never be more. The second one is, the mandate doesn't turn on whether a person intentionally fails to purchase insurance. And the third one is, the ASA prohibits the IRS, the tax office, from collecting the shared responsibility payment through punitive means such as criminal prosecution. So these three are also in the back of the mind of the judge's reasoning. And the second one, which was more controversial, is Medicaid expansion. So the court decided that the Medicaid expansion is unconstitutionally coercive of states because states did not have adequate notice to voluntarily consent, and the Secretary could withhold all existing Medicaid funds for state non-compliance. The court remedied the constitutional violation by circumscribing the Secretary's enforcement authority. So they decided that Medicaid expansion is unconstitutional because it coerces the states to act in a certain way, and it takes states almost sovereignty to decide for its own. So they make it more. It was already voluntary for many states, but they were giving a lot of subsidies for the states who said, by they I mean the Congress. The Congress said they would be subsidizing some of the states funding for healthcare if they allow Medicaid to be expanded. This changed a little bit with this decision. So the Supreme Court's decision on the Medicaid expansion being unconstitutional does not change or invalidate the language in the ACA about a new eligibility group. It still exists in the law as a new mandatory coverage group beginning in 2014, and some states already passed into those states, like Kentucky, as I said. However, the practical effect of the court's decision makes the Medicaid expansion optional for states, because if states do not comply with the Medicaid expansion, the Secretary may withhold only ACA Medicaid expansion funds. She may not withhold all or a part of non-compliant states' federal funds for the rest of the Medicaid program. Before, it was the case. To be for the states to be expanding Medicaid program would be subsidizing all the other expenditure for Medicaid. So the Secretary cannot withhold all or a part of non-compliant states' federal funds. By non-compliant, within non-compliant Medicaid expansion. So there's no coercive power on states to apply this federal decision by the Supreme Court. So what does it mean for people? So it is up to states. The implementation is up to states. Millions of Americans under Republican-run states will be out of Medicaid expansion because they didn't accept it. So they always thought that in Obamacare, And Obama is Democrat, as you know. So many Republican states said no to Medicaid expansion as a matter of political stance, and 26 states rejected the ACA. The irony is that these states that are, this is from the New York Times article, an expert opinion. The irony is that these states that are rejecting Medicaid expansion, many of them southern, are the very places where the concentration of poverty and lack of health insurance are the most acute. A founder of the community health center model. It is their populations that have this highest burden of illness and cost to the entire healthcare system. So, who is out when you think about Medicaid expansion and the South being more run by Republicans and not accepting the Medicaid plan? So let's see who is out again. So, if you remember the intersectionality we talk about and how certain inequalities come together, let's think about all of them together. And in this case, who is out and who is in control is one of the most important questions as we were referring to intersectionality model or theoretical lens. So race, gender, class, politics coming all together. And through the census data, we right now know that almost 8 million people are uninsured because of this Medicaid expansion clause by the Supreme Court decision. So that could have been under insurance. Who live in poverty, which means $19,530 for a family of 3. So they don't have any assistance at all right now. They are opted out. And these populations are not by chance, are the populations that are already poor, mostly poor blacks, single mothers, underpaid workers, and in the South. So it's a regional thing because of the politics aspect. Politics plays an important role. Due to this plan being Obamacare. And I gave the Kentucky article to make you think about what it could change, what it can change in certain places if certain policies are implemented. But before I go to Kentucky, I should tell that ideology is a very powerful tool. So if you think about this Affordable Healthcare Act as a political tool by the Democrats, and it's an Obamacare, then you may be against it just because you don't like Obama. And this is a very ideological thing to do. But if you think of its actual implementation, it only does expand the healthcare toward the most disadvantaged. And it includes the poor according to the income. And as you may very well notice, the poverty is never just about class or income. It is also about race, gender, and sexuality in many ways. So, and I'm not saying actually the Affordable Care Act is one of the best care acts you could do, but it would have, and it can have still, some positive impacts for certain contexts. For certain contexts, maybe it should really be challenged, and I would like to think about your challenges, your ideas about this as well on the comments. The Kentucky shows us how it can have a positive impact. It might have a negative impact as well, and unintended consequences, of course, since we are sociologists. So what happened in Kentucky? If you read the article, you know that the state chose to expand Medicaid, since it was up to states, states government, and there was a drop in the uninsured rate immediately, and it has been the sharpest among the nation. And his hospital revenues are up, healthcare jobs are multiplying, and far more Kentuckians are getting preventive checkups and screenings according to state officials. I remember at the first I was saying that preventive care will be for free, so this was the part of it. And if you follow the article well, you will see the teeth removal of the lady, and how it is important to have all these screenings and all these checkups, and also dental care as another.
Now that we went through what was the Affordable Care Act, and it just changed. So I thought that it's important to know what is there, what was there, and how did that happen, and how was the impact of it. And there were many complaints, especially by middle-class families as well, to challenge Obamacare or ACA, because they were paying more and the co-payments for the medicine was increasing, and there were some payment-related criticisms behind it. What is going on now and what will happen is a very political and politicized question. It's a bit shame that we discuss these things as if it's a football match, because it is about playing with people's lives. And whoever supports which group says the opposite, basically. You know better than I do. This political conversation going on for a long time, and you are subjected to it all the time on your TV. So you know it quite well. The anticipation is that 23 million Americans will lose their insurance due to so-called Trump Care, or the repeal of Affordable Care Act. Although the details are very, very complex to understand, and it will take some time to implement. So there are some congressional and Senate decisions that will follow these days, and see what will happen. But there are a lot of things going on in terms of like, okay, so now a lot of people will be uninsured though. So what are we gonna do with those? We don't know. Most of the time, we see that when uninsurance increases, the emergency care increases as well. So basically, the less people are insured, the more emergency care the state will pay. And I wanted to show it to you what is expected and what could happen from this video of Huffington Post. Let's see what they think. So that is part of it, and you can read the entire.
Thank you, Mr. Chairman.
Sorry, you can read the entire article by Huffington Post. I already sent it to you. What I am suggesting to stop here, because the Learning Affordable Care Act and what will happen now, basically, is a difficult question. And as I said, it's a very politicized question. And the article we talk about, I mean, if it's crafted as passed by the House Republicans, we will see if it will be approved or not. And then we will see how it will continue. As many of you already started to discuss, there's a lot of things going on about insurance for pre-existing conditions, which is quite ironic in many ways, because if you have a pre-existing condition, probably you need healthcare more than anyone else, and insurance companies do not like not giving them any insurance is a quite tricky thing, to be honest, and it will definitely affect access to healthcare, especially among poor populations, as we already discussed. There's one more thing I want you to not miss. It's in your readings in Sakai. These are all Fox News and Time are videos, so please watch those videos. I just want you to watch this one for sure, so I'm gonna put it here anyway. Also learning the language, like what is a single payer system? Like everyone talks about single payer system, what does it really mean? This video is very useful to give you just a very small brief idea of what it is, and there are a lot of countries using it. And while watching SICO, you will see Canada, Britain, and Cuban healthcare system, and we will discuss Cuban healthcare system more because it's part of my study, and I do research in Havana still. So you will see. Let's watch what is a single payer, and so that we can continue in the next class. What is different in Cuba in terms of the states and the citizens, the patients' relationship. Sorry. Let me do this so you see. Okay, there we go. There's a problem in the video, I guess. But you got the idea. So basically, what we keep discussing about single payer is written in this article quite clear. Medicare for all. So there won't be all these insurance companies you will look for, but everyone will be under Medicare. And this is the case in many countries, to be honest, which is not so revolutionary, or which is not so different than existing systems already. But it will be mostly run by public and private organizations, but the state will be the only payer, and the state will regulate the public and private organizations in general. So I don't want to go more, because I know it's a long video, and I promise next video will be a bit less, actually much less, because you have documentaries to watch, and I will assign them. One of them is Sicko by Michael Moore. It's not your generation, but you might have heard. It will show you different healthcare systems and what can be the problems in the United States, what can we learn from other countries, and what are the systemic structural inequalities that the system in the United States reproduce. Michael Moore is a very controversial character, but it has a lot of interesting details in the documentary. Another documentary will be on Cuban healthcare system, and I will upload it very soon. It's a bit heavy, and it is a friend of mine who did it. It is about the Americans who go to Cuba to study medicine for free, and their story of why they went to Cuba to get medical education. And I hope both of them will be a lot of fun in terms of learning more what's going on in these systems, from medical education to actual implementation of access to healthcare. So, and we will talk more about Cuban healthcare in the next video, which will be not more than 25 minutes, half an hour at most. So, hope you will have enough time to watch all the rest of the documentaries. Hope you liked the class, and hope you did all the assignments on time. What I was gonna say is I send you talking sheets that I want you to write in different colors so that we can communicate with each other. If you didn't receive an email, a Google Doc sharing from me, then let me know so I can do it again, because I did with all of you. And I started writing there. I will also post your individual grades there, and I will send a general email with an Excel sheet of your grades, pass, or out of 10 kind of grades for the first week assignment that you did, as an Excel sheet. I will send it to you with your numbers, so you don't have to compare with your friends or anything. You can just look at your number, which is known only by you, and you can see your grades next to it. Hope that makes sense. Have a great week and take care. Bye bye.